Hi, guys. Thank you for joining. This is Essence of Medicine, and we're talking about dementia. I'm Amanda Armagost.
And I'm Dr. Abbasi for Essence. Amanda, why did you choose this subject?
I chose this subject just because it's something that I thought was a little bit interesting. I know that my understanding of dementia is not that it's a specific disease, but last week we were with Dr. Fennell and we were talking about the carnivore diet, and he said something interesting that I never realized. I didn't know this fact that now, hopefully I don't misrepresent it, but
Mhm.
Alzheimer's is considered type 3 diabetes. Is that correct?
Well, I haven't heard that term before, but it's certainly it's a chronic debilitating disease. But have you had ever contact with somebody who has dementia directly?
Yeah, I used to work at Perkins.
Except me.
I wasn't going to throw you under the bus, but I used to work at Perkins. And I worked in the morning. So a lot of my guests that would come and visit me were like people on field trips from their dementia or from their memory care facility that they live in, or just
Mhm.
people who are with their families. And sometimes the families would warn me ahead of time, like, hey, just so you know, he has this and that going on. And like they would my experience with dementia people isn't or dementia patients isn't as intense as a lot of other people. I know that they can get mad and things like that, but I've pretty much had a good experience with them. I know that they do get a little bit more upset or frustrated
Mhm.
because they're stressed, confused, things like that, but then also can be a little bit inappropriate,
Yeah.
like sticking, like I've had guests at Perkins stick their hands in my pockets and stuff like that, and it wasn't because he was being weird, but he just had dementia, so he wasn't totally with it. He didn't intend to make me uncomfortable.
Yeah. Well, for people who have like more contact, like parent, grandparent, with dementia, it is not being forgetful. It is way more than that. It is practically when a global capacity of the brain is reduced below the level that this patient can take care of themselves.
But there's
Like,
earlier signs of it too, like lack of ability to problem solve. People get more
certainly,
frustrated,
yeah,
language issues.
yeah, all of that. It's a global phenomenon of the brain. So, I can forever. I mean, even if I was young, I could not remember people's name, but I can do other things very well. So it's not being forgetful, and obviously it comes in all different variation and all different severity. But um, our brain has certain function. Let's talk about what are the regular function of a normal brain that we take it for granted every day. We like language is one of them, right?
Yeah, language and then problem solving we talked about a little bit, but that's
Problem
a huge
solving,
function.
memory,
Like I don't know how I want to
mood
say it, but
control. No, no, it's actually exactly what it is. Our frontal brain is part of the brain that every kind of thing we learn in life, like rules, etiquettes, and so on, it gets stored in our frontal brain. And let's recount them. Um,
language,
language,
mood, problem,
well, language, mood, problem solving, social behavior,
reasoning.
reasoning, calculation, and so on and so forth. So these these are a combination, and you just need to go and talk to five people. You see that each person is good at better or worse at one of them, right?
Mhm.
Somebody is good at calculation, had no social capacity, or is awkward and so on. We call them nerd. Some people are total empaths, but they overuse it, sometimes even to manipulate people and so on.
I don't think I do that, but
I never mentioned even your name. And some people are called robots because they are hard workers, they good at deduction, but social interaction they are lacking. So there's a combination of um, behavior all controlled with our brain.
Mm-hmm.
Like mood, our mood is mostly controlled in a very small area of the brain. We call that amygdala, which is we have two on each side. Literally, if you put 2 inch go in this direction and you hit my amygdala on both sides. And eventually, as a matter of fact, when we are born, obviously a baby has very little function. Everything that happens is just a reflex. Like um, they don't even really recognize faces at the beginning, because many of the cells in the brain are not the connection are not made, and they are not even myelinated, meaning that when we are born, and that is exactly why we are human. When we are human because our brain grows and develops a lot longer after we are born. A giraffe, when a giraffe is born, uh, literally 5 minutes later stands up and starts running. You don't see that with human, do you?
No.
Okay, so and that is because our brain, actually, when we are born, a lot of our nerve cells have to die so the others can make proper connection. This is not a really bad dying. Literally, our brain comes with too many cells. Some of them have to what we call regress. The other one make connection. That connection has a sheet of fat around them to make them communicate faster. And that is what makes us truly a human. The capacity of our brain in different area organize itself after we are born. Like, when do we start walking?
Like 7 months.
Yeah, 7 months to a year, we start walking. But usually we expect almost every child with 12, 14 months to be able to walk, right?
Yeah.
And if it doesn't, then we call that developmentally delayed. Now, when do we start talking?
Like 1 year.
Not really.
I don't know. I don't have children and I never studied them. I don't care to either. So let's talk about dementia.
Gremlin is, when do we become gremlin?
When we're hungry.
So usually we start talking about 1.5 year and understand the concept. Usually we expect for the children to be able to talk and communicate in a simple way when they are 2 years old. Okay.
Yeah.
What it takes in that time is that our brain organizes itself, myelinates, and so on. And obviously, motor is always more important. We have to be able to follow our parent and get away from danger and so on and so forth.
Mm-hmm.
And then we start reasoning actually around the age of 4. But then our brain at that point start just myelinating, making connection, learning. Language become more refined. As a matter of fact, in that age, not in that, between the year before age of 7, you can learn 50 different language if you are exposed to them. Okay. So brain is like a sponge. It accumulates all the knowledge. How do we accumulate that knowledge? What's our best understanding how we accumulate the knowledge? It is because the brain make connection. We call them synapses, and create pattern in the brain that when like the word book comes in, the word book from my auditory system, the pattern gets recognized. That pattern fits the visual pattern that resembles a book. They get connected. Their connection from the word book to the visual thing that I imagine what the book would be, and all the memory of the book. All of these are connection in our brain for synapses. Do you know how a neuron look like? Neuron in a traditional way look like a cell, then had lots of small little feet going out, and then one long foot going out. Lots of small foot coming in, one long small foot going out. Those small thing, we call that dendrites, and the long one that goes out, we call them axon. So our brain, contrary to like a transistor of a computer that has only few connection, can have thousands and thousands of connections. And that is how our brain is organized to absorb the knowledge in pattern that is conductive to our survival, to whatever we do. Now, to the things that you and I talked about, as well come our motor behavior, like, things that are basic. Like you remember we talked about the language, calculation,
Yeah.
deduction, social interaction, emotion control, and so on. But as well, there are lots of other things that are much more basic, like how to move, what to do, how to ride a bike, and so on and so forth.
Yeah.
Not surprisingly, those things that are more basic, they are more deeper in the brain. So we growing and we start accumulating knowledge in certain order. And not surprisingly, emotion control comes pretty late, right?
Hmm.
I mean, that's the definition of a child. Oh, I don't want that. A temper tantrum, the terrible twos, and so on and so
Yeah.
forth. Now, and our brain develop and develop, and eventually, our brain is what we call an adult brain, and then it still develops. And then something happens. Maybe we just get old, but maybe there's another disease like Alzheimer. In Alzheimer, a protein accumulate in certain area that our brain cannot get rid of it. That start the cells start dying. When a neuron start dying, connections that is related to that cell as well go away. When those connections go away, those pattern of behavior of the brain, those pattern of like I hear the word book, that pattern is connected to the visual pattern of the book and all my memories of the book. When when the neuron that is between literally is out of function, is dead, then that pattern is not functional anymore. Now I hear the word book, but I cannot visualize the picture of the book in my brain
Right.
because the cell between the neuron between is gone. Now, not surprisingly, there are certain diseases that are accelerating this neuronal death, like Alzheimer, like Huntington disease,
What
like
about like if you don't get enough blood flow to the brain, like if you had a stroke
that's a
or
stroke. Yeah. Now, the thing with the stroke is that very localized, meaning
yeah,
that stroke usually, if you have a global stroke, meaning that the whole brain doesn't get blood supply, then yes, but 8 out of 10 times, when you get a stroke, that one area doesn't get blood or it starts bleeding to one area, then one area is more. And guess what? Our brain, that's exactly what I'm telling, that the dementia is not that acute like stroke and so on. It's a global phenomenon that in the
yeah.
entire brain, cells almost like, homogeneously everywhere start dying. And when they die, this pattern of behavior, this pattern of function of the brain start going down. Like and that's something very fundamental about that. We usually things that we learn early on, we learn them early on because they are vital to us. Like guess what? Motion is vital to us.
Right.
Language is vital to us. And um, then other things are vital to us more than the others. Now, things that we learned earlier are more robust because those pathways are maybe they're instead of like one or two neuron, or I'm just taking that number, but maybe instead of 1,000 neuron, maybe 1,000,000 neuron are in charge of that. So if some die, there's still enough to make sure that function is safeguarded. And it makes sense. If you have a very important building, you put 100 police officers to secure it. But if you have a not that important building, maybe you put only two security guard to safeguard it. In our brain, our function are the same. Those functions that are very, very vital, they have more neurons involved in that.
Sure.
And now imagine you statistically these cells start dying everywhere. Guess what? It's a dementia is a retrograde development. Are you
My
familiar
under
with that?
but my understanding of dementia isn't that it's caused by aging. My understanding was that aging is like the biggest risk factor, but not because of like the risk of getting dementia. Like not you're not getting it because you're old, you're getting it because you have other diseases that are impacting your brain.
It's a combination. Like Alzheimer is a premature death of the cells because they accumulate the protein they cannot deal with. Huntington disease, the same. There's a we call multi-infarct dementia. When you get small little, like you have a heart problem, and a small little amount of embolus, they shoot to brain and they kill everywhere, a little here, a little there, a little there, and then you have again this global. And guess what? When you get older, all those problems accumulate more in the older age.
Right.
But even without any of those disease, eventually, like any other organ, brain is an organ that it loses its capacity, its function, and it is nothing unusual about that. That when people get older, overall their function goes down. So dementia is practically what we call a retrograde development. Have you watched the movie the Benjamin Button?
Yeah.
So you see, that's a beautiful poetic way of putting that, that how the beginning and the end of the life are the same. That
Yeah.
first thing you learn is to walk. The last thing to you actually lose is almost as well to walk, because when you stop walking, we have actually something that we have done studies about. If an elderly person quit walking, no matter for what reason, their life expectancy is about 6 months. So shorter than if they're diagnosed with cancer. That's why we Inspired Spine, we are so good at keeping them on their feet because we don't want them to decondition.
Right.
Now, and then like memories that are older, you lose them last. Memories that are younger, you lose them first.
So
So
I'm just gonna say it in another way. What you most recently learned, you will lose first, but what you learn first, you will lose last.
yes, older memories are more robust. And there's a reason they're older memories. Yeah, you need to know your mother, your sister, your brother, and so on. But the friend that you met just last month, that is less vital to you. Okay, um, so practically, dementia is a retrograde development. Now, and here, if you understand that, then you understand another thing, how to prevent that. That is the beautiful part of it. If you understand the disease, how it works, then you have the tools to counteract that. Now, you remember, all our brain does develop those connections, those synapses. And make no mistake, nobody's going to live forever. All of us are going to die, and even in the best situation, that aging process is going to be in our entire body, but in our brain, those cells are going to die. Now, we don't create new cells in the brain, but that's not what the important part is. It's about the number of the connection that those cells have. That makes our brain functional. We call them synapses. The axon and dendrites, they connect together and they exchange information chemically. We call them synapses. The number of the synapses you have is a function of who you are and what you can do. Now, guess what? How do we increase more function, more synapses, more connection in our brain? Because when they start dying, if you have a lot of this connection, then you have more gas in your car. Your car can go farther and so on.
Mm-hmm.
How do we develop more connection in our brain?
By doing puzzles, learning more, playing different mind games with yourself.
Well, generally just having new experiences.
social interactions. I think
Any
I
kind of
read, yeah,
experiences.
I read a lack of social interactions can actually increase your risk of getting dementia.
Yeah, yeah, absolutely. And generally, learn. Every time you learn something, you're creating those synapses, those connections. More of them you have, more of them you can lose before dementia, at the way we consider it as a disease, become clinically important or clinically, I would say, visible. And learning is not just learning a book or something. It's about learning having anything that's new, any experience that make your brain work.
Even
Like,
like, isn't even building Legos a form of learning because you're putting things together?
well, I think anything can be a learning, but then if you continue doing that, then it's not really learning anymore. You're just you remember we talked about that your brain has many areas, and those areas that have different function, you have to accumulate knowledge and learning in different area of the brain. Okay,
Mhm.
and my learning, putting together Legos, maybe they make part of your brain good, but there are other experiences that make other parts good, and so on and so forth. If you start accumulating them together, then you can have a global increase in your synapses and connection in your brain. Then you have more to start with, and then when you start losing, then you are in better condition to withstand the ravage of time.
Yeah. But other factors too, like learning, of course, but then like you can't just sit on the couch drinking alcohol and eating like highly processed foods and say, "Oh, I'm doing Duolingo, so I'm good." You also should be being active, eating a healthy diet, not drinking a lot of alcohol.
Well, all of that is obviously, listen, if you don't have a good nutrition and good motor skills, is a learning. Okay, all of that. Yoga is a great way of, making your body have form and shapes that it wasn't used to.
Yeah.
Okay.
Yeah,
Uh,
especially with it's kind of interesting you brought up yoga because sometimes I get into a yoga position and I literally think to myself, I never would have thought that my body can do this.
mhm. And you remember that. Now, let me give you another example that's not that unusual or not different. Um, you go back and forth from work to home 5 times a week.
Mhm.
Barely you remember anything about those trips, right? Because they are not important to your
Right.
trip. Imagine one day you're driving from work to home or vice versa, and you see an elephant on the highway. You will not forget that, right?
Mhm.
Because it is different. It is not the usual. And that's what I'm saying, have always new experiences, and that experiences can be motor experiences, new poses in the yoga, or new sport, or new something,
Yeah.
or art, science, whatever, new things that, and because if you're doing the same thing over and over, you're just using the same paths that are already developed. Same way that you drive, okay, first time you were driving from work to home or vice versa, you were paying attention. But then once the paths are there, is not really additional learning there.
Yeah. Right.
Now, do you know what is it that truly safeguards that we always learn new experiences?
What? Reading
Reading
books?
books. Yeah.
Yeah.
No, we have
What
some.
about, sorry, but what about if you, okay, because one of my favorite topics to read books about is historical fiction. So it's not, I'm not like, it's not true stories always. They're a lot of times based off of true stories, but I still feel like I'm learning something because I'm learning something about like a historical time. Is that still, even though I'm not like learning, is it still a
Mhm.
form of learning?
Well, everything is a form of learning. Now, they put electrodes in literally, they put electrodes in the brain of the monkeys. And when a monkey watches with electrodes in the brain that another monkey doing something like grabbing a fruit, the same kind of cells in the brain of the monkey that watching it get activated. That when the monkey is thinking, while the monkey is watching that, same cells that make the other monkey grab the fruit get activated. We call them mirror neurons.
I heard the same thing about watching the Olympics, that watching sports actually does something to your body where it kind of thinks that it's, do you know what I'm talking about?
But that is why we like watching sport. That is why we like watching a movie. That is why we like watching and talking about other people doing things. Because once we do that, we get a little bit of a pleasure they get by actually doing it in our brain through our through our mirror neurons.
Okay.
So, and that is explain why theater exists, why a movie exists, why we watching sport exists. That's why people gossip when they want part of it. Okay, is that we get pleasure, like that. But we get pleasure watching somebody eating a cake
Yeah.
because part of our brain that eating the cake in that they get activated and so on. Or when somebody has a, when somebody when we watch a sad movie, we start crying. Well, the person who died is an actor, has nothing to do with real life, and we don't even know that thing and so on. But we still get sad and cry because that experience literally imprints itself in a similar way in our brain. So when you read a book, no matter what you read, you get there. When you read a book, let's say about the life of a person, you don't get all that part that he was brushing his teeth and so on, right? You
Yeah.
get the highlights. You get all those, you don't get the regular drive from work to home and so on of that person. You get the drive that he got to see the elephant on the highway. You get the extraordinary part of their lives.
Right.
So that always will give you something new to learn. So um, obviously there are many factors there, but reading books, in my opinion, or listening to the books, or watching movies and so on, that is actually I mean, there are dumb movies out there, obviously. So are dumb books and so on, where you do the same thing again and again, and then that really doesn't add anything to your experiences. That's not what I'm talking about. By the way, I can tell you a personal story. I started reading when I was very young, and there is this French writer. His name is Balzac. It's not a joke. His name is really Balzac. Okay. And I read almost all his book except two. The last book I read from him was The 40-Year-Old Woman. In the middle of the book, I just noticed all his books are the same. It is
Hmm.
just a different name and different thing. It is all, and then I just dropped that book and said, that's just nonsense. That's just like, and then and there are series of books that, like a drama and like there's like one of those soap operas.
Yeah. Yeah, there's a lot of different types of books.
No, but what I'm getting at, um, books are as well a good medium, but if you're just reading the same kind of book, like watching the Survivor or the
Okay,
Next Man
well, hold
Thing.
on. Survivor, I wouldn't really put that in the category that you're putting it in because like I don't watch Survivor, but my understanding of Survivor is that they have to like do these little challenges
Yeah.
and puzzles and stuff like that. So I don't
After the
think,
ninth season, you will see that things are what I'm getting at. Watch the first two seasons, but mix it up. Maybe
yeah.
watch 90 Day Fiance for few seasons, but after the fourth season, all those dramas and so on are going to be repetitive.
Okay, well, here's the thing, and we're not talking about dementia anymore at this point. We're talking about TV. But what I'm saying is there's reasons why you should have a show that you like to watch And that's pretty much the only show you watch because you should not be sitting on the couch enough to know every episode of every TV show. And there are negatives to watching violent things. So I'm a 90 Day Fiance girl. That's the only show I watch, and I'm pretty proud of that.
Okay. So we are talking about dementia, how to prevent that, and by having a lot of different
Yeah.
experiences. And the best
So
way,
other things than just watching TV, like get out, do activities.
books. It's always come back that the books are a very good way to have new experiences in your life, to increase the number of the synapses, so that when your time comes, you have more uh, to spend.
Yep. And audiobooks. That way you can do something outside too while you're listening.
Absolutely. Audiobooks are very good idea, especially in our busy life sometimes that we don't get the actually to spend a lots of time read sitting down. And but again, once the driving is the routine, you can fill the gap with additional experiences.
Yep. Thank you guys for watching. This was Essence of Medicine, and we talked about dementia. I'm Amanda Armagost.
And I'm Dr. Abbasi for Essence with the nose bleeding.
Thank you. Have a good day.
Bye bye.